It's easy to see why vaccines are such a contentious topic, especially for parents of young kids. Vaccination rates are actually tracked through kids in kindergarten, and they've been slipping for the past 4 years. And right now, only 93% of kindergartners are vaccinated, which is below the 95% needed for herd immunity.
Yeah, ever since the pandemic, experts have seen confidence in vaccines is eroding among some Americans. And it's not just with the COVID vaccine, it's kind of with all kinds. Polio was detected in New York in 2022, which was scary. This year, there was 16 measles outbreaks compared with just 4 in 2023. And this year, there was a 5-fold rise in whooping cough, which is a respiratory infection. It killed about 9,000 infants a year before the vaccine was introduced.
And perhaps no one is a bigger poster boy for vaccine skepticism, and he'd be the first to say, than Robert F. Kennedy Jr., who President-elect Trump just nominated to be Health and Human Services Secretary.
Yes, you've definitely all heard of RFK. He's from the revered Kennedy family. He recently ran for president, actually as a Democrat, before dropping out and joining Trump's campaign. He's also known for some unconventional health beliefs, like pushing to remove fluoride from drinking water, or himself drinking raw and pasteurized milk, which goes against the FDA's recommendation because of all the bacteria and viruses.
Oh my God, yeah. Did you see that the brand of raw milk that RFK drinks is being recalled because of bird flu detected at the farm?
Like, literally the thought of, like, dirty raw milk spreading disease.
No, I know.
He's also very much against processed foods and is running a Make America Healthy Again campaign, which is one of his few initiatives that the medical community widely agrees with.
Yeah, RFK is really into that natural way of living, other than admitting that he does get testosterone replacement therapy.
Yes, the only shot he seems to be okay with.
But for every memeable RFK moment, there's more serious positions that he takes that draws condemnation from the health community.
According to The Times, he has worked around the world to weaken global health policy for half a century. He has lobbied against vaccination efforts, protested against agencies like the World Health Organization, and even undermined sex education camps that are trying to curb the spread of AIDS in Africa. Apparently, he believes that AIDS are actually spread by poppers in the gay community and not the HIV virus.
And he calls himself a vaccine safety activist.
Can you name any vaccines that you think are good?
I think some of the live virus vaccines are probably averting more problems than they're causing. There's no vaccine that is, safe and effective.
But his record seems to indicate a more extreme opposition to vaccines. He called the coronavirus vaccine the deadliest vaccine ever made and compared vaccination records to the Holocaust.
Even in Hitler's Germany, you could cross the Alps into Switzerland. You can hide in an attic like Anne Frank did. Today, the mechanisms are being put in place that will make it so none of us can run and none of us can hide.
RFK and most vaccine skeptics believe that there is a link between mumps, measles, and rubella, which is the MMR vaccine, and the autism spectrum disorder. And there are different camps of thinking on this. Some people blame it on thimerosal, which is a compound that prevents these vaccines from growing fungus and bacteria. And then other people actually believe that vaccine dosing schedules are too close together and can overwhelm immune systems.
But these theories have been widely discredited by many scientific studies all over the world, including one that analyzed the health records of over 95,000 children and found that the MMR vaccine did not increase the risk for autism.
But because signs of autism appear around the same time that children get the MMR vaccine, the scientific community says that people mistakenly kind of connect the two events.
But let's be clear, other than very rare instances, vaccines are safe, they reduce healthcare costs, and they save lives. In fact, the CDC estimates that vaccines have saved 1 million lives in the US just in the last 30 years and prevented more than 500 million cases of disease.
And just a quick science refresher, vaccines are weakened versions of viruses and bacteria that are injected into your body to help trigger a natural immune response. And research says that vaccines help children safely develop natural immunity compared to getting immunity through natural infection.
But despite the science, RFK has sown distrust and lobbied against vaccinations. The biggest example of his work was in American Samoa.
In 2018, which was pretty recently, the Samoan government stopped all immunizations after a freak accident in vaccine administration. So RFK took this opportunity to actually go to Samoa and meet with government officials and anti-vax influencers in what health advocates say is a significant disinformation campaign. Then, while all of this was happening and vaccines were at a low rate of 30%, there was was a measles outbreak, and that killed 83 people and caused over 1,800 hospitalizations of mostly babies and young children.
And Samoa is a small, tight-knit community, so this was obviously devastating. Here's how the governor of Hawaii described the scene on the ground.
We saw dead children. We saw the remnants of that anti-vax campaign by RFK and his organization. We saw devastation, and he scared the wits out of everybody in Samoa.
And in addition to RFK's solo work, he's also served as the chair of the Children's Health Defense for almost a decade, which frequently campaigns against vaccines and calls itself a child health protection and advocacy group.
They take credit for the fact that public schools don't require COVID vaccinations, defend doctors that are under investigation for spreading false information, and notably in 2020, they helped finance a sequel to the viral Plandemic video that alleged that COVID was a global conspiracy.
According to the Center for Countering Digital Hate, RFK is one of the world's top disinformation super spreaders. They even put him as a member of the Disinformation Dozen. And because of that, he was suspended from Instagram, which only reaffirmed his idea that big tech and corporate institutions are conspiring to suppress him.
Yes, and in line with that thinking, he's promoted the disproven idea that 5G cellular networks allow governments to collect user data and control people's behaviors. He's also pushed the theory that said COVID was ethnically targeting Caucasians and Black people. Quote, "The people who are most immune are Ashkenazi Jews and Chinese."
He has repeatedly endorsed the idea that mass shootings have increased because of antidepressant use. He's claimed the CIA killed his uncle. And he's argued that chemicals in the water are changing children's sexuality and gender identity. And before we go on, we just need to say there's no evidence that any of these are true. And in fact, they've all been disproven. But that takes us into what he'd want to do if he's confirmed as HHS Secretary. So he hasn't said a ton of exactly what he's planning, but he has said he'd give infectious disease research a break for about 8 years, and he'd want to end the FDA's war on public health.
Again, it's government corruption. It's that the agency, the USDA, the FDA have been captured by the industries they're supposed to regulate. And they all have an interest in mass poisoning the American public.
In his new position, he would be in charge of the nation's public health and scientific agencies like the CDC, FDA, NIH. And all of these agencies combined actually have an overall budget of $1.7 trillion and employ 80,000 scientists, researchers, doctors, and other officials.
And we know we've told you a lot of information already, but if you take one thing away from this, please let it be what we're about to tell you.
Yes, Wren and I are going to run through a checklist of everything that experts say would be under RFK's purview as HHS Secretary. Maybe we need a special newsgirl sound effect for this one.
Ooh, definitely. So having oversight of all of these important agencies gives him a lot of power to impact vaccines in this country if he chooses to. The CDC director who approves vaccine guidelines would report to him, and he'd also select members of the CDC's immunizations committee or have the power to completely get rid of it. And they set the childhood vaccination recommendations and schedule.
He would also oversee the FDA, which is responsible for approving new vaccines. So he could bring on people to make the process for approving new vaccines a lot more burdensome. For example, the FDA shapes clinical trials, so he could slow down the process, which would de-incentivize pharmaceutical companies from pursuing vaccine research and development.
He could require vaccine makers to list even the very rare side effects on vaccine packaging labels. And he could also weaken legal protections for vaccine makers, because basically right now drug companies are protected from being sued, but RFK could open companies up to legal liability.
As you can see, he would have control over a lot, and he could really overhaul a lot of the ways that our health agencies work today. And people are worried because with RFK and Dr. Oz and Trump's other health nominations, most of who also share RFK's anti-vax beliefs, these people don't really have a lot of experience running huge bureaucratic agencies.
But they are good at talking about their views on TV or social media.
And interestingly, vaccine stocks like Pfizer and Moderna dropped dramatically right when RFK was nominated.
Well, medical experts are sounding the alarm. A couple weeks ago, Scott Gottlieb, who served as Trump's FDA commissioner, said,
"I think if RFK follows through on his intentions, and I believe he will, and I believe he can, it will cost lives in this country. You're going to see measles, mumps, and rubella vaccination rates go down. And like I said, if we lose another 5%, which could happen in the next year or two, we will see large measles outbreaks."